Welcome to the Nurse Practitioner Professor podcast. I'm your host, Dr. Scarlet Spain. I took a break away from recording in the past few months just because life's been quite busy. So with the new year, I did want to start releasing some new content. I've got some really exciting speakers and topics lined up. So I'm hoping that everybody will join me in this new year as we start talking again. I do want to give an intro to myself, just for those of you who don't know me. Again, I'm Dr. Scarlet Spain. I'm a full-time assistant professor at St. Mary's College of Notre Dame. Over there, we have a family nurse practitioner and an acute care nurse practitioner, where our topic for today kind of is deriving from. I'm also a practicing occupational environmental health nurse practitioner. I've been doing that since 2010. And I'm also a healthcare consultant. And I'm also a editor-in-chief for Stat Pearls for occupational health content. So again, nice to meet everybody. I do have some previously recorded podcasts. If anybody has interest in taking a look at those, you can find those on my YouTube channel. So our show today is going to be an exciting one. Again, as mentioned in my role at St. Mary's, we have a family nurse practitioner track and an acute care nurse practitioner track. So when I started over there, well, and one of my best friends who's here with us today happens to be a family nurse practitioner and an acute care nurse practitioner. So when I started over there, I kind of became interested more in the role, and then just watching Dr. Bump, she's been doing this in the past year, which I'll explain what this is in a second, but just watching her journey, I've become more interested in what actually an acute care nurse practitioner does. So today I would like to welcome Dr. Jamie Bump, and I'll give her a second to introduce herself. And actually, Jamie, if you want to go ahead and introduce yourself.
Hey, everybody. As Dr. Spain mentioned, I am Dr. Jamie Bump. I am the DNP program director at Valparaiso University, and I'm also a full-time assistant professor here. As she also mentioned, that we have a family nurse an FNP program here at Valpo, and we're exploring options in the acute care role as well. I also work clinically as a hospitalist, and have previously worked in cardiology and intensive care. And I also work within a medical spa, interestingly enough, doing aesthetics and weight loss. I'm very happy to join you. I am very passionate about acute care, and I really look forward to talking about it with everybody.
Awesome. Thank you so much, Jamie, for chatting with us today. So before we really get started, I just want to give a brief intro into the historical context of the nurse practitioner role. And then Jamie and I will talk about, again, how that's expanded a little bit. So Dr. Loretta Ford, who I've actually had the honor of meeting, she established the first nurse practitioner program at the University of Colorado with Dr. Henry Silver in 1965. So at that time, their goal was specifically looking to increase patient access to pediatric care. Boston College soon followed them and initiated an MSN entry just 2 years later. And by 1973, more than 65 nurse practitioner programs existed in the United States. And by 1979, there was approximately 15,000 nurse practitioners practicing in the US. So we've obviously had a great expansion in the role in the past 4 decades to where we're at today. So the nurse practitioner role is consistently voted as one of the top jobs for growth and outlook here in the US. And there are more than 385,000 nurse practitioners licensed in the US today, according to the American Academy of Nurse Practitioners. Out of these numbers, 88% of nurse practitioners are certified in an area of primary care, and about 70% of NPs deliver primary care. So here we're going to go ahead and turn our focus into the role of the acute care nurse practitioner. I'm really excited about this conversation because I know I'm going to learn a lot as well. So Jamie, can you briefly provide us some historical context and day-to-day job task of the acute care nurse practitioner? And you can even give us some comparison as compared to the family nurse practitioner.
Sure, I'd be more than happy to. And I don't have dates in front of me of when the acute care NP role really was developed, but it is more recent, obviously. And it was built on a need of to have providers working in teams to take care of acutely and critically ill adults, largely in hospital settings, but also within long-term acute care and in some ambulatory care when we're talking about like chronic heart failure and end-stage heart failure management. So the differences I see between the role of the FNP and the role of the adult gero acute care nurse practitioner is that we tend to work more in teams rather than totally independent. Not that there isn't opportunity for independence within an AG ACNP role, but it is less so than what we see in family. They're, a different patient population foci, and really being able to monitor, patients with hemodynamic instability in that acute setting. So we don't see the, Monday through Friday, 9 to 5 type of job. It's more a 24/7 role. So, you know, not meaning that, I'm responsible 24/7, but that they need a provider present 24/7, 365 days out of the week. So I would say like working hours is a big difference. So you may have working hours in the adult gero acute care realm that kind of mirror working hours of the RN. So we work holidays, we work weekends, some of us work nights. Um, uh, so the patients are, different. They're more acutely ill, but it also then can include a lot of invasive procedure training and credentialing, which may be less so in the FMP role, although FMPs do various procedures as well.
Mhm.
Um, but it's definitely a different knowledge and base and skill set than the family nurse practitioner.
Thank you for providing that. That's interesting that you talk about group dynamics. And again, I'm trying to fill in the blanks because you and I talk every day and know each other so well, just so that people are listening. But I've never thought about it that way. But that makes really a lot of sense when you talk about that because it is a bustling hospital system as opposed to a lot of times in family nurse practitioners, you're in an outpatient setting and maybe working with another provider or a couple other providers, but you are um, I don't want to say independence isn't the right word, but yeah, sometimes those group dynamics may look a little bit different. I can appreciate what you're saying there. So thank you for
Yeah,
providing that.
I would say with the AG, and this is my experience, so I don't want to speak for everybody who works in this role, but I would say that we largely have that patriarchal type of like where there's a hierarchy still,
Hmm.
even though we're all collaborative team members, but we are working with physician oversight on our team. Now that means different things. It could mean that, I'm on nights alone caring for patients, admitting patients to the intensive care unit, but I have a physician that I can use as a resource or who is ultimately responsible. Um,
Hmm.
so yeah, it is team-based care more so in this role than what I see my counterparts in the FNP role.
Okay. So again, for our listeners, Jamie has a very unique and really, really cool background. So can you provide us, our listeners, because again, she is a FNP and acute care. So kind of tell us a little bit specifically about you and your nursing career, what you did as an FNP, and then what your goals are now as an acute care. And by the way, for our listeners, Jamie just graduated. So congratulations
Yeah.
from Duke University, and I'll have her speak a bit more about that too.
Okay. So, I was a late entry into the NP role. I practiced as a nurse and I did various things in quality and performance improvement on it on the administrative level prior to deciding to get back into clinical and going for my FNP. Um, I would say that I was pretty largely unaware of the LACE model when I returned to school. And I wasn't exactly sure where I wanted to end up either. My clinical experience as an RN was largely in ICU, various ICU settings. But I want to say that I really didn't know what I wanted to do with my FMP. Looking back on it now, it probably would have been a wiser decision for me to go into an adult gero acute care program from the get-go. But having my FMP has served me well as, additionally. So I initially worked after getting my FNP in 2015 from Valparaiso University. I initially worked within cardiology, and I did inpatient and outpatient. And in a lot of geographical areas, that's going to be an acceptable thing, even though that's really more of an adult gero acute care role. And I had my FNP because it was acceptable because they took all of my nursing experience in the acute care realm. Although I will tell you, having gone through this program now, it was such a painful transition into the provider role. Possibly, I want to say more so because my training as an FMP did not prepare me for acute care.
Mhm.
And I had to fill those gaps or figure out how to fill those gaps very quickly once I was working in that role. By finding courses, by reading, by exposing myself to guidelines that I didn't get in my FNP program because I was being trained to be a family nurse practitioner, not an adult gero acute care. So then once I did cardiology, I went into hospital medicine and then ultimately landed in pulmonary critical care for a number of years. Again, always filling those gaps that I felt I had. Um, I I identified a need for myself, that despite the fact that I was accepted in my work environment with just my FNP, that I really wanted to seek out my adult gero acute care. So that's when I decided to go back and get that through Duke University's program.
Awesome. And that's what you just graduated from a couple weeks ago or almost a month ago now,
Yeah,
right?
yeah. I'm still waiting for my certificate, but yeah. So I did what is known as a certification alignment program. So there's various ways to get your AGA CNP. You or be eligible to sit for your certification exam, but which by the way, I've not yet sat for. Um, you can do a certification alignment. So if you are already working and have experience in the acute care setting, there are some programs that are known as certification alignment programs. There is a postgraduate certificate program. So if you have your FNP or you're a psych NP, and you want to go back for your adult gero acute care, you could do a postgraduate certificate program. Or maybe this is your first foray into becoming a nurse practitioner, and you can just enter into, like St. Mary's has their adult gero acute care NP program. And how they differ is really about what courses you're required to take and then what clinical hours you're required to do. So I'll just jump into describing the
Yeah,
program a little, if
please
that's
do.
okay. So the program that I attended at Duke University took me a fall, a summer, and a spring, a summer, and a fall semester. It amounted to 12 credit hours for me. So this is a certification alignment. So my first semester, they collected, first of all, I had to submit all of my FNP courses to prove that I had an advanced assessment class, pathophys, and a pharmacology. And then also where my clinical hours were, because I did do some clinical hours in internal medicine where I was dealing with some chronic conditions that would be potentially deemed adult gero acute care. Um, I also had to submit like all the last few years of my continuing education hours, and then had to complete clinical hours in my place of employment, which at the time was in the medical ICU. I had to also, with those clinical hours, submit procedure logs, and as well as documentations of some of the patients that I took care of during that time frame. And then from there, I went into the summer. I had a didactic course, acute care, and a clinical. So they do kind of a gap analysis, which I was pretty good at identifying myself where I lacked any experiences in acute care, and mine were largely CV surgery and than in the neuro ICU. So my first, the summer I completed clinical hours with CV surgery, and then had a didactic course. And then in the fall, I had a didactic course and completed my clinical hours within the neuro ICU. So that took me up to completing this certificate. So I'm waiting to be able to get my testing permission from ACCN. So that's where we're at.
Awesome. It's been really fun watching you the past year and just your passion for acute care. And of course, it's fun because then I get to learn from your experiences as well. So that's been fun. So you bring up some really good points, and thank you for describing all that. I do want to backtrack just a little bit, and we don't have to really dive into this, but just something that you said made me think about something, Jamie. I just want to remind listeners that it's really important for nurse practitioners to work within the correct setting and to demonstrate competence in their specialty. So the consensus model, and that was 2008. Am I thinking correctly on that? Sometime 2006, eight,
Somewhere
something like
around
that.
there. Yeah.
Yeah. So the consensus model sought to provide a more uniform model of regulation and really stress the importance of this. So people who are thinking about going back to school, make sure that you are exploring what you really want to do. And there's ways, obviously, Jamie, you've found ways to obviously follow your passion. But it is an important thing to remember. So, all right. So another question for you, and you kind of touched on this, but we'll see if there's anything else. Do you feel that your training provided you, so you're passionate about providing acute care services. Do you feel that your training provided you with what you needed to be successful in that role?
Training with my original FMP program or the
Either, both.
okay. So I think that I kind of touched on this a little bit. I was not adequately prepared to work in the environment that I worked in with my FMP. And even having 20 plus years of critical care experience as an RN did not prepare me for the provider role in an acute setting. So I think that while there are many of us who do that, um, I think we are the ones who are successful in doing that, are really attuned to what their needs are and are jumping on that and self-learners and self-motivated. Um, More and more, I will say that, and depending on what geographical location you're located in, um, I would not have been hired in that acute role with my FMP. In fact, at one point, I had applied to be a hospitalist at an academic medical center in Chicago and was told they only hire adult gero acute care for those roles. So you need to be really mindful because despite your nursing experience, it's really not adequately preparing you for that specialty. I had physicians who were really open to also training me and being open to me calling them every 5 minutes about with the questions. So that mattered as well. So it wasn't just all me, it was also who I was employed by.
Right.
And some areas or some organizations may also offer a really strong like orientation or fellowship program. And I would say that could prepare you. But the best way to do this is to go into the correct training from the get-go. I would say now that I've gone through, and this is obviously after having 8 years experience as an acute care NP without the training. I would say I learned so much from that program, even this recent program I went to, even after all of my experiences, things make more sense now. I'm able to put the story together. I am stronger at identifying the correct differentials for patients. I would, even though I've now have even more student loans, I would not have it's not a regret that I did this program at all.
Oh, that's awesome to hear.
Yes.
And just from you sharing, you had some really cool experiences with your clinical hours. And I know that you adored your faculty and just the way that you learned. And yeah, so congrats again. That's so exciting.
Thank you.
All right. Well, I think that's all the questions I have, unless do you have anything else you want to bring up for our listeners?
No, I don't think so. I don't think so right now about the role. I think that, it is very important um that you go in the right track.
Yeah.
Not to, again, I think I was an awesome provider without this program. I filled in those gaps, I think, pretty well, but
Yep.
I have many friends and colleagues who practice acute care with their FNP, and hopeful that maybe there is a way to this certification alignment process is not very painful. I mean, it's 1 year
Yeah.
basically.
Yeah.
And so hopefully more of those come around so that FMPs practicing in that acute role will be more likely to seek out that certification.
Awesome. Well, thank you so much. For our listeners, thank you for listening. Again, please remember that Dr. Jamie Bump is the program director at Valparaiso University. She's easy to find on the internet if you have any questions for her. I work at St. Mary's of Notre Dame, where we have FNP and acute care. So I think I can speak for us both that we're very passionate about preparing our future nurse practitioners. So please reach out to us if there are any questions or we can assist you on your journey. With that, I will say goodbye and hope to see you all on the next episode. Thank you. Bye.
Hi, thank you.